Langley. Jeff,
Thank you, Matt, and thank you, Raymac, for hosting this today and for inviting me as your guest speaker. So I appreciate the introduction and appreciate everybody's time today. And I think one thing I did not want to do, and Anna and I talked about this before we did on a call earlier last week, I think it was last week. We're not going to do death by PowerPoint here. So I'd rather do this to be conversational. So I think the chat box works good. If people want to stop me at any point too, that's fine. I'd rather present information that's useful and relevant for you all than to just kind of do the standard public health spiel. But I will start with that. And I've tailored a few talking points to be hopefully for some of our work that's more germane and more relevant to the work you're all doing in the business community. And so with that, I'll just get started. Some of you, Jeff Neubauer, Liz Powell, we've had the pleasure of working together on things in the past, and it's great to see you both here. For everybody else, it's great to meet you. So Racine County Public Health Division, as Matt mentioned, used to be known as Central Racine County Health Department. There's not a lot of difference as far as how we're operating today as opposed to before we became a division within the public health, within human services. The main difference really comes around the financing. And so when we were Central Racine County Health Department, we had contracts with 14 of the 17 municipalities in Racine County. Instead of listing all 14, we did not have contracts with City of Racine, Elmwood Park, or Wind Point. Those two municipalities contracted with the city, and there were two health departments, City of Racine and Central Racine. We can go a little further back, but we won't. But there used to be three health departments: Western Racine County, Central Racine County, and City of Racine. During the COVID-19 pandemic, you know, one thing we always prided ourselves on here at formerly Central Racine County Health Department was we operated on a very lean budget. And we expected a lot out of our employees. And so we got a lot of work for, you know, a big bang for a little bit of money. And that's great when you don't have to deal with the ongoing public health crisis. But with this long, as you've all experienced, this sort of long-term public health crisis, really, you know, that sort of strength that we had became our weakness. And we, the Board of Health at Central Racine County approached Jonathan Delagrave, the county executive, and inquired around becoming part of Racine County. And just so you're all aware, most municipalities or most health departments across the state are county health departments. The arrangement here in Racine is somewhat unique, and it's rare nowadays. And there's been more consolidation versus the other direction, and the state won't even allow the other direction anymore unless there's extenuating circumstances. So we got agreement with the county, and our Board of Health approved to dissolve the Central Racine County Health Department and form the Racine County Public Health Division. That was made effective January 1st. Through that process, Wind Point and Elmwood Park also signed on to that agreement. So we serve all of Racine County except for the city. So just keep that in mind as we're talking about the work we're doing in Racine County. So we ground our work in state statute, administrative code, and it all comes down to what's called the 10 essential public health services. And I won't read them off to you, but they all coalesce into sort of three programmatic areas for us: community health and home visiting, environmental health and emergency preparedness, and then of course our administrative functions of the health department. And again, if we want to put more buckets around the work that we're doing, they all either tie back to some kind of assessment, and that's assessing at the population level. We're assessing the community, developing policy, and providing assurance. And so policy development involves things like advocating for health equity in policies and making sure that informing our county board of supervisors on health implications of certain policies that are being discussed or talked about. It also, the assurance is, you know, that's sort of a bread and butter piece for us. That's where We're linking people from the public with services that maybe even we don't provide, but the county does or some other entity. So we do a lot of linkages. Public health is moving away from individual service provision and more to, acting at the population level. And that's really where the goal is for us. We are a nationally accredited public health department through the Public Health Accreditation Board. That's for some of you who have gone through accreditation processes, those can be quite time consuming and grueling. And this was just like that. But we were accredited about 3 years ago, right before COVID pandemic, and we maintain our good status with them. As a health department, we are governed by a board of health. That board of health was appointed by the county executive in January when we established the new county public health division. We have 3 county supervisors. And then there are 6 other at will or at large board members. One of them being a physician and the rest having some type of medical knowledge, whether it be a nurse or some other medical expertise. So that's our governing board. And of course, we're under the county structure. And so, certain things need to go through, contracts and all those things go through the county board per, county policy. But with us moving to a division within public or within human services, it allowed us to achieve some economies of scale. Despite still having 2 health departments, we were able to streamline some things just that, before when we wanted to do very few public health issues did not involve the county. And so now we're part of the county instead of having to collaborate with the county. So that makes our operations much more efficient in that we're just part of that structure now. It does give us that better infrastructure support. When some of these early in the pandemic, when some of these grant funds became available, like routes to recovery and some of these monies that were designated for municipalities, as a multi-municipal health department with no home, if you will, we did not have access to some of those funds. And so this again, now with the county, this would not be a problem moving forward. And again, I mentioned, we're just able to be more efficient in the way we do our work. So with that, I think I'll transition to some of the overlapping areas where I think that you've either maybe, if you take COVID and put that aside for a minute, and these are areas where maybe you've heard had to work with us in the past, and if not, we welcome opportunity to do so in the future. For one, every 5 years, we're required to do a community health assessment, which then informs a community health improvement plan. So this assessment, what we do is we look at all the publicly available data and privately available data that we have access to. And we bring that data to a group, and that's our CHIP partner group, our Community Health Improvement Plan partner group. Liz Powell actually was part of that. Our last group was part of Central Racine County Health Department, so she's somewhat familiar with this. And we did some really good work around suicide prevention, which got upended with the pandemic, but I'll come back to that. But what we do is we bring this information to this partner group, and it consists of people in the nonprofit community, our healthcare providers, our business community. And we actually would love to see more representation from the business community, because we know that, there's an element to government work that's important for you all. And I think there's information that you may learn too throughout the process around some of the health issues that our communities face that you may or may not be aware of, and can be part of some of those solutions in a different way. So we are in a current CHIP cycle right now. So that means during 2022 and probably into the beginning of 2023, we will develop a brand new community health assessment, present that to the community, along with the community health improvement plan, which will narrow down our focus areas. That plan should have no more than 4 or 5 sort of main health priorities that the health department is going to be directed to focus on for the next 5 years. Now, I said set COVID aside. Let's bring that back real quick, and then we're going to put it back aside because it's just people's not favorite topic, including mine anymore. So, but we're still dealing with it, and it's still a relevant issue for the community. From a business perspective, one of the things, I mean, clearly you all were impacted by some of the early measures that were put into place and that kind of thing. Our focus as the pandemic went on was to, of course, meet our statutory obligations first and foremost, and that's investigating communicable disease. Investigating cases of COVID was not new for the health department. There have been statutorily required communicable disease investigations for decades. And that's what, really, some of you, I don't know if you've ever worked with us on an outbreak before, but we've had outbreaks of salmonella or norovirus or E. coli, those kind of things. We do this work on a daily basis, largely under the radar for the most part. And we do it in a way that's least restrictive and least impactful to the community at large. So, we just focus on what needs to be done, and that's that. So COVID put that work definitely into it brought it bare. You saw the process. Isolation and quarantine is not a common thing with communicable disease investigation. It was for COVID because it was novel, it was unique, and it needed to be done in the beginning. I think one thing where I thought we did well, and we did receive feedback from the business community on, at least in our jurisdiction, was that, as you all probably remember, one day the guidance was this, the next day it was that, 3 days later it was something different, and a week after that it was something totally different. And so it was really hard for people to keep track of what was the current recommendations, what are the current guidance. We tried to digest that for our constituents, and we really took a focused effort to try to make sure that we could get this information out into sort of three groups: the general public as one, schools and daycares as a second group, and the business community as a third. And actually I would add a fourth one in there, and that was our healthcare institutions, particularly nursing homes and assisted living facilities, which were impacted greatly, particularly in the beginning. And what we tried to do is really provide an educational role. Granted, we had an authority role in this, but we really took a more collaborative role with our businesses and said, what questions do you have? That was always our starting point. What can we help you understand better? And then what can we help you with? And a lot of the businesses we worked with did work with us on contact tracing, and we helped them put systems in place within their facilities or their companies to do this work in a way that's least disruptive, that was consistent and fair for all their employees, and that was relevant to the current guidance. And so that's a philosophy that we have, not only working with businesses, but just in the community in general, is that we work with and we don't work at or to, or however you want to put it. We get much better results with all of our work by collaborating with people and trying to meet them where they're at, and then being honest still and saying, this is the guidance, no one likes it. Let's figure out how we're going to do it. So that was our role, particularly with the business community with COVID. We're also, the other current relevant things aside from COVID that were here before and are still here now, opioid problem. We still have this opioid epidemic. We have overdose crisis. And we have partnered with the county, and in one way where we can help you all, the county is doing, and the behavioral health division is doing Narcan trainings for businesses and that kind of thing. So if you had employees, and I think we all like to think that we don't have employees where this is a problem, but I think the one thing that the opioid epidemic has shown us is that it's really defying I don't want to use a stereotype, but it defies who you think has this problem. And it's, there have been businesses that have put nalox boxes and Narcan and needle exchange type things in their business, and the stuff is gone within days. And the only people who have access to it are their employees. And that's not a bad thing. It's good. It's harm reduction, and that's a route that's needed right now. And one thing we can do is provide you all, whoever's interested, if you wanted to have a rescue box in your business, those are called nalox boxes. So it's a secure box that has Narcan and some other rescue supplies in it that become easily accessible in the event that you have an overdose in the workplace. And so it's just a good measure of preparedness. And it's something that the county can help you all with. As I mentioned before, Liz and the Racine Community Foundation worked with us as a CHIP partner on advancing some of our mental health initiatives at the health department. Mental health, and in particular suicide prevention, was identified as a major theme we should focus on with our last plan. And one thing that we did, and we did rather quickly, was we looked at all the evidence-based type things you can do around suicide prevention, and we tried to digest it down to what can we do today? What can this group actually accomplish today? And one of the things, and it's super easy and it's common sense, it just makes sense, is that getting suicide prevention information into the hands of those who need them is one of the best things you can do, aside from trying to fix the mental health system, which is outside of our scope locally. So we came up with an idea that really started to take off, particularly in the nonprofit sector and in the schools, which was printing suicide prevention hotline information on the back of an ID badge. And that's something that we were able to start doing with a lot of our schools, and they started printing it for their employees. They started printing them for their students, and we could change the colors to match their branding schemes and everything. And so we started to see this take off, and then the pandemic hit. And so we are going to be looking to reboot some of that. So if anybody's interested in that kind of thing, again, we can help you all with coming up with something that makes sense for your community and for your business. Some of the other things we do, if any of you have restaurants or own a hotel or have any reason to be licensed by the health department, that is something that our environmental health division here does. And so we license restaurants, tattoo parlors, pools, hotels, motels, wells, and all those kind of things, taverns, bars, restaurants. I think I mentioned restaurants. And so again, same philosophy though. We go in, we have a food code, we know it needs to be done, and we try to help the business owner understand what the rules are so that they can apply them, so they can have a successful business and not have an outbreak of food poisoning, let's say. And so that's the thing we're trying to do when we're working with our licensed establishments. They get in, we inspect it. We aim to inspect all of our places at least twice a year. One is required by our contract, but we try to do two. We find that it just seems to be more successful that way. We're also doing some prevention work around, like I said, suicide prevention. We do some childhood injury prevention work. We've been convening a child death review team that meets in the Racine County that reviews all childhood deaths with the eye toward how could this be prevented. Some of you might remember, gosh, it was probably close to 10 years ago, there was 3 drownings down in North Beach in like really quick succession, and it was toward the end of the summer. And the child death review team looked at those 3 cases in totality and wrote a letter to, I believe this would have been the city's jurisdiction. We wrote a letter, and the city was part of is part of our team. Wrote a letter to Parks and Recs and said something needs to be done. Like there needs to be some things for next season that look different. And indeed they did. They took those, they actually came up with recommendations to put in lateral buoys down at the beach. So you knew if you were going to get towed toward North Pier and sucked under the rocks, there was lateral buoys going out, so you'd hit that rope. They increased their lifeguard patrols. They purchased a jet ski to increase rescue time and that kind of thing. So that's the kind of work that we, when you do those kind of groups, that's what we're looking to do. We're looking to just, you take unfortunate events and you try to prevent them from happening again. And so that's really like the nuts and bolts of what we're doing, and the sort of the overlapping places I saw potential with the business community. But I think I'll stop here and just see if there are any questions. I'd be happy to answer them.
Did you want to go first, Matt, or?
Yeah, I put a question in the chat box. Anna can read that, but another one came to mind is, Jeff, are there areas where we as the business community don't even realize it, that we can be helping you and you have a need? I try to meet fairly regularly with human services, county executive, to have these discussions. From time to time, your predecessor and I used to have a conversation. But if there's areas where we can help that we don't even realize, could you point that out for us or let me know? I mean, obviously, we'll do what we can.
Yeah, most certainly. I think I think, the one area, prior to COVID, we did not have a lot of interaction with local businesses. We just there was not a lot of need to, if you will. I mean, we were able to do our work, and we mostly did it with the public individually. And sometimes it impacted the business if someone needed to be excluded from work or something like that. And I think, then outside of some, obviously everybody always needs funding, and that kind of thing. And so, but that's not something we would typically go to the business community and ask for. Having said that, when COVID arrived, and we've touched more businesses in the last year and a half than I think I could count in my 15 years of public health. And so we've created some new networks, if you will. And the one opportunity I see that didn't exist before is there are times where it's really helpful for us to be able to push out information aside from your standard press release, which nobody reads the paper anymore, or, just trying to get messages out through our social media. I think businesses offer an opportunity to push out information quickly, factual, truthful information to their employees, which you all have a much greater reach than we do. And you have an important role to play as an employer in the community. So I think I think for us, what we want to do is also understand what you all feel would be most important for your employees, instead of us telling you we think this is important for your employees. So I think it's a two-way dialogue there, and that, we could take our best guess, but I think sometimes it's helpful to be informed. And I think, like I mentioned before, as we're going to reboot our community health improvement plan for this next 5 years, I would love to see, we would invite more business participation on that group,
Sure.
And so that's something that I could send out to Raymac through you, Matt, if we had a call for, if we needed 5 or 6 business partners, if that's something you would push out, I think it would be a great partnership to have that. I think is a huge missing piece on when we're trying to solve some of these community problems.
Sure, we absolutely be happy to do that. And I think, as you pointed out, COVID really did change some things. And I think a lot of it started with the partnership that we've had for many years, but also when we put the Rebound Racine County plan together. The county executive and I got together, and the county executive spearheaded that, especially when we, had approached and the city didn't want to be a part of it, which kind of shocked me. We welcomed the opportunity to partner with the county and put that together. And I think a lot of businesses benefited from that. I know we were able to connect them to PPE equipment that they could not get or had a hard time getting, and things like that. So absolutely, whatever we can do to help.
Yeah.
Okay. Anna, you want to jump to the box?
So a question just about the different health departments that have been around the region for a while. Is there any progress on one combined health department with the city of Racine as well? Any discussions on that?
Yeah, I mean, it does come up from time to time. When we moved over to the county, when we approached Jonathan Delagrave about asking if the county would consider having us as having a health department instead of this municipal arrangement we had before. Obviously, he was very open to it and has been super supportive of public health pre-COVID and during COVID and now. And I was not privy to those conversations that happened in the background. It's my understanding that there was an offer made and declined to have a single county health department. And so we needed to move forward though with our plan. And like I said, throughout that process, we did gain 2 additional municipalities with Village of Wind Point and Village of Elmwood Park as of January 1st. So, we're always open to having that discussion when the time is right. So, and again, I can't speak to what the city does or doesn't want to do. I do know there was an offer made and it was not accepted.
Anna, anything else in there?
Yeah, I'm just kind of formulating to look through this. 1 second. How big is your staff, and is the health department world, the environmental health department world seeing the same struggles as everyone else? I'm
Yeah.
sure nurses are hard to find, and that's
Right,
sort of
great.
the aspect of your industry.
Great question. I mean, finding good employees right now is really tough, and I'm speaking to the choir here, I think. You know, we have about 32 employees currently, and we're just about fully staffed. I would say that the hardest positions to fill right now are nurses, and that's because we cannot compete with the private sector. It's just really tough, and we can't offer giant signing bonuses and crazy amounts of overtime and that kind of thing. So a good fit as far as nurses go for public health are those who are sort of done with that hospital experience and want a little more stable hours, want to serve their community in a different way. Those tend to be good fits for us at the health department. But just to give you an idea on what our workforce looks like, in fact, all of our employees here have at least a bachelor's degree right now. And we have created some new positions within the health department called public health strategists. And this aligns with the direction that public health as a field is going. And so these are all master's prepared people who really help with the critical thinking and putting into place things that we just couldn't do before. So like convening community groups, that was typically like a management function, and managers need to be managing the department, and there is a role for us in convening community groups and things like that, but we also need people who can take the reins and run those groups, get that work done, and convene and collaborate in a real meaningful way with everybody. So we have public health strategists, we have public health nurses. Our public health nurses primarily do communicable disease investigation. They do immunizations. They follow up on lead poisoned children. So they're going to those people's homes, providing some education and some material for the parents. And then we also send our environmental health team out and they do a visual inspection of the home. And the important thing there is that, and for anybody who know landlords or own property, there are lead grants out there available right now. So if you had a child who had an elevated lead level and we can document that, that opens up access to funds to get windows replaced, doors replaced, either for low or no cost. And so there are obviously some certain criteria that have to be met. But again, most people don't even know these things are out there. So, and then on the environmental, the other thing nurses, before I move on to environmental health, the other thing our nurses do is we are providing, for those of you who employ families with young children, we aim to go and do a home visit for every new mom that gives birth in the community. Now we have a great partnership with Ascension right now where we can come on site and do that. And we schedule that visit for about 3 weeks after you go home from the hospital. But again, if this is something that, if you had employees who, particularly if you have a lot of women in the workplace or women of childbearing age, families that were, they're having babies, if they're a Racine County resident, odds are, they may get a visit from us. And if they haven't heard about that, that's something we would want them to hear about. And so, but I think we think that's a really valuable tool and a real valuable service to the community, because not only do they get some reassurance at a time that's really hard, 3 weeks after a baby's born, but also we can, again, link them with all the existing things that are in the county. So if they need healthcare, we can link them with healthcare or healthcare network. We can link them to economic support with the county or child support, all these kind of things that people need. We can try to make that easy for them. And so, again, being linkages for people in the community. So that's what our nurses primarily do. And then on the environmental health side, we have our sanitarians and public health specialists who go out and do the restaurant inspections and the pool inspections and the well inspections and all those things. And that's there's roughly 5 or 6 people in that division. So by that kind of summed up the workforce, if you will.
Do you have any relationships with any nursing programs at the local institutions, Gateway?
Yeah,
Racine,
good
I think,
question.
is a good nursing program.
We used to. Prior to COVID, we had we would host students from UWM, Alverno. I don't recall if we've had Gateway or not. I'm not entirely certain on that. The one sort of thing with public health is, by statute, a public health nurse has to have a bachelor's degree, and I think with Gateway and it's an associate program, our site would not offer the technical skills that would be probably desired in a nursing program. But we could work if there's community health education courses, if you will. That's where we could have a role in some clinical placements. But typically it's the universities that are looking for us to have their students who are in their public health or community health clinical semester that's required for their bachelor's degree. That's what they're looking for. And then we're getting a lot of requests from master's programs, including online ones from all over the country, just to have students placed. And we were doing that prior to COVID, and the pandemic really changed that for us. But we are looking to get back into that arena again, because we want to pay that forward. All of us who are nurses, or even you all probably have had mentors who, gave you an opportunity, and it meant a lot. And so we want to pay that forward with nursing students too, so I think Jeff had a question.
Yep. Do you have adequate funding to visit all the mothers who have their babies through Ascension All Saints? If not, how many days per week are you able to visit? Yeah, that does sound like a lot. But maybe what's even like some data? What's the number?
Yeah, sure. So right now we go there Monday through Friday. Now we do catch most of the births because most women are in there for 2 days. So granted, it's also my understanding during COVID, they shrank that down to 1. So we could be missing people. Prior to COVID, we were not really missing too many people. But by and large, we go there Monday through Friday, first thing in the morning. So we do not currently have funding to sort of recruit 7 days a week, if that's what you're asking. And we don't have enough funding yet to serve the entire county. And that would mean, what I mean by that is sort of putting a network into place where we can find the births that occur not in Racine. So Ascension does about, if we go data here, they do about, the last data I saw, they had just over half the births, Racine County births, give birth at Ascension. The rest go to either Frederick South in Kenosha, Aurora, West Dallas, Aurora Sinai, Aurora Lakeland. So that's all the people who live on the west end of the county are going to typically end up in Elkhorn. And and then Pro Health, we see some births out in Waukesha too. So we don't have enough funding to sort of tap into a coordinated network, if you will, to try to recruit everybody. But right now we have enough to do on site just at Ascension.
Are there any, that's interesting. And thank you for that. Are there any other collaborations that you can think of that you have through nonprofit organizations, anything with RUSD and the academies?
Yeah, so we were part of a lot of different work groups. So we were part of Higher Expectations and some of their subcommittees and sub work groups, particularly in that early childhood space. That I would say that for our health department, that's an area of expertise for us. So we collaborated quite a bit with Jeff and his group at Higher Expectations. With Unified, they and the county, they had a Healthy Wisconsin Partnership Program grant, which was really targeting the early elementary school age activities at RUSD in particular. And we served on a few of those different work groups as well. And but since the pandemic interrupted basically all of our operations, we're in a little bit of a reboot mode. So but yeah, certainly we love to be at those kind of things, and I think bring a good lens to those type of work groups. So, but again, I would also make the argument that some of these work groups, we needed, I think, more business participation too, because I think there's a real big missing perspective. When you have, I just for our work moving forward and starting with our community health improvement plan, I really would like to hope that we could have some additional business partnerships to have that voice that is, I think, so desperately needed.
Absolutely. When you and I were talking, getting planned for this, I think sometimes the health department world lives in a little bubble.
Mhm.
And then when something big happens, like a pandemic, then people go, oh yeah, forgot there's health departments. It's just kind
Yeah.
of comes out of the woodwork,
Yeah.
at strange times. So absolutely, we can help with those conversations moving forward.
Great.
I don't have any other questions in the chat box. If anybody
Okay.
has any last ones.
Christopher, it looks like you put a link out there. Did you want to comment on that?
Yeah, Christopher, I think you got cut off. Yeah.
Oh, definitely. I just want to express that there's some federal resources available. Jeff, when you talk about healthcare and all that stuff, I know us specifically, we came to extensions for the African American infant mortality rate. And so there's a lot of things around the medical world that we're interested in. Also, we have a grant writer in our office that can assist you as well if you need something or some support. But yeah, you're definitely 100% right. The business community is very needed in all aspects because on one end, it helps facilitate a message. Whatever that message is, people can get that information, whether they have it on their wall or they're passing it out with sales. I think a lot of times everybody is in a silo, but when the business community is connected to it, it seems like everything circulates more fluently.
Yeah, so if you weren't looking in the chat box, Christopher has a link to some different federal grants and for general information. So I'm glancing at that right now, if that would be helpful to anyone.
Yeah, thank you, Christopher. I just clicked on that as well. So, thank you.
Great. Okay, well, we try to stick around to the 45-minute mark, and we're right at that. So if there's no other questions, Matt, do you have anything to wrap up?
Yes, Jeff, thanks for taking time out of your busy schedule today to be with us. As I
Yeah,
mentioned
thank you.
a little bit earlier, this is our last one of these. We will return in September. And I know Anna is in the process of putting together another great set of speakers for us. So look for our return in September. And if you have any questions in the meantime, feel free to reach out to us. And Jeff, you and I will continue to have conversations. So let me know how we can help.
Thank you so much. Appreciate everybody's time today, and thanks for listening.
All right. Thanks, everybody. Have a great day.
Thanks. Bye now.